Assalamualaikum warahmatullahi wabarakatuh. And very good afternoon to the all judges and to all the participants. My name is Irfan. I'm a pediatric radiologist. I'm from Kuliyyah Medicine. With my teammate is a brother Tarmizi. He's an international radiographer. So for today, I would like to present regarding malrotation anatomical positioning system. First of all, I'm very sorry, my slide is not very fancy compared to others because I'm very conventional. Okay, so hopefully I will convey to you the message of my presentations. Okay, both of us are team members. So we name is our innovation is a MAPS, is a stand for Malrotation Anatomical Positioning Systems. So we go for the how this develops. Okay, so when the patient baby came at the night with the greenish vomiting, we call this bilious vomiting. So first of all, we need to think of the obstructions at the junction of the renal junctions. So this is very emergency because the malrotation, if you not go to OT as soon as possible, they will turn to be gangrenous bowel, they will get necrotic. Okay, so this is the example of the 3 X-ray images. So this, all the babies came with the bilious vomiting, but which one is having like malrotations? So for the chest X-ray, even I'm a pediatric radiologist, I cannot determine whether this X-ray is these patients are having like malrotation. So what do I need to do is I need to do a contrast study. I need to give a contrast to evaluate or determine the DJ junction or position to make sure whether this is not rotated. Okay. So I go to the malrotation a bit. So this is a normal position of the patients. So usually the DJ flexure, this is a duodenum, they will be located at the over the left of the body at the L1 of the vertebral body. So we have that cecum on the right side at the lower quadrant. So we have the very long mesentery. But what happened in the malrotations? So because they have like short mesentery, so there will be like torsions. So the DJ flexion will be on the right side of the whole body and near to the cecum. It's very emergency. So they go out because they will get patient having like obstructions, and towards the end they will be ischemic and necrotic of the bowels. Okay, this is the example. This is intra-op findings. These are dilated bowels. This is a DJ that I need to locate these positions. This is a normal viable bowel. This is necrotic. If you like very late to intervene, they will come like this, and patient will having like short bowel syndrome. So my problem statement is, so duodenal variance is diagnosed in 8 to 20% of the upper GI study. It's very high. Okay, the incidence. So the compromised quality contribute to poor interoperability and may result in diagnostic errors. So they will raise unnecessary interventions and or delay treatment. So am I the only pediatric radiologist think of this problem? No. In worldwide, this is like a common issue to determine where is the DJ flexure. Okay? So we go the upper GI study. Okay. So when you look at the chest X-ray, so this is 48 days old baby with the bilious vomiting. So what can you do? You just put the rice tube into the stomach and you aspirate a bit, and you put the contrast. You put the contrast to make sure to see where is the DJ junctions to diagnose this is got the malrotation or not. So you follow passage of the contrast in the lateral position first. Okay, we do lateral. Then you need to turn the patient in the supine position. This when the contrast reach DJ on the lateral, then quickly this problem arises. So why? Because in the reality, in the real life, patient is moving, the baby is moving. So you cannot like still the patients during the procedure. But you must make sure the patient is not turned, because you must make sure the DJ on the left side of the vertebral body. So if you like make a rotation, you will make unnecessary or you will make error. Okay? The image frontal, you must make sure when you turn the baby, this is the stomach or this is the duodenum. So DJ must be on the left on the vertebral body. You must make sure this one is, but must make sure is not rotated. Okay? So this is the normal pylorus D1, D2, D3, D4, and DJ must be on the left. This is this is good example because this is very symmetrical. So when it's very straight and you get the DJ on the left side. Okay. So the image we want like this. Okay. The DJ is located on the left side of the vertebral body. This is the like we call the gold standard. Okay. Then when you get contrast, you can see here. Okay, but the image we get like this, and like this. So how do you want to make sure this baby having like malrotation? Okay, so you need to repeat the fluoroscopy, and you need to give a contrast, extra radiations, and when the patient going for op is normal, turn out to be normal, but you waste all the time, you waste all the money, you waste the patient need to intubate and everything. Okay, the image we get. Okay, the reporter usually I will be recommend is need to repeat because it's non-diagnostic. So I'm not sure whether this is malrotation or not. So they need to go to the OT if patient like unstable, or you can repeat the next day or the next few hours if patient is stable. Okay. So any better after another 10 years? This is from the Children's Hospital of Philadelphia. So most of the they reviewed the 100 of images, so with the 2 pediatric radiologists. So one review called 10 is non-diagnostic, and another called about the 2 is non-diagnostic. But the quality of the most of the is 58% is low quality. You cannot get the gold standard images. It's very high. So it's very high. So the number of abnormal, same of the readers in high quality, but if low quality, you will misinterpret the malrotations. So 5 overcall of malrotation by readers in low quality, and interoperability significantly is higher in high quality. So this is good technique. When we put the patient in the lateral side, we follow the contrast and everything. Then the problem when you need to turn the patients very quickly to make sure the contrast is moving to the left. This is the problem because you want to maintain or the patient is not moving. Okay, this is the problem is. So this real life is not easy. So performed by my medical officer. So because I'm the only pediatric radiologist, so I'm on call every day. So they just grab these images without the coordination. So they turn out to be this is abnormal. So patients go to OT. So same goes to this patient. It's very like rotated. So you don't know whether the DJ pressure is abnormal or normal location. So the solution or innovation what I do is, okay, so this is a rotated child, this is vertebral body. The DJ like I think must be on the left on the vertebral body. Okay, but when this patient is like a bit rotated, the DJ position will be on the right. So you're not sure whether this is a real malrotation or not. Okay? So what we can do is, we put the marker on the below on the xiphoid sternum and also at the umbilicals. Okay? So when you get the images, you will see you get the marker on the true lateral. Okay? So you must make sure this will be like, if like contrast on the left side already, you can make sure this is malrotation. Okay? So this is the example. When you do rotated, this is the marker. Maybe it's not very clear because of the resolution. Okay, so when you rotate a bit, you will see the marker is here. Okay, so what I invent is, from the leg down, this is one or tail leg down, okay? It's like, we discarded the leg down here, that we don't use anymore. So what I did, I cut the leg down, okay? I cut the leg down and put at this marker, put at the xiphoid sternum and also the umbilical to make sure there's very center. Okay? So when we image the contrast, when image the study, we will put that here. So we make sure the patient is center, so the contrast will be on the left side. So if contrast is not crossing toward the left, So it will be, I'm sure this is malrotation, but if the contrast to the left side, so I'm sure this is normal. Okay? So this innovation will solve two problems. Okay, medical waste management. So recycling lead gowns from the damaged radiation protection gowns instead of disposing them. Usually they will discard all the lead gowns to the waste. The radical will discard that. And clinical improvements. So since the project emphasizes for the environmental innovations, I'll make sure that the sustainability is the main story, but the clinical benefit becomes the added value for my project. Okay, this is an environmental impact because I'm using the waste product from the leg gown, one pair of leg gowns. So for the market opportunity, target market can be in the government, so this hospital or some private hospitals. Every radiology department having fluoroscopic machines, and they will be beneficiary for the pediatric patients, radiologists, radiographer, and also the hospitals. So for the secondary, they will benefit for the waste management units and also environmental agencies. So for the progress and validation, this is like a pilot study because I'm using the lead gown, so I'm not testing that I'm already tested to the few numbers of the patients, but it's not like commercialized yet. Okay. So for business model commercialization, I think it's a sustainable, low-cost radio opaque localization from marker. So it can be can be in a hospital, universities, or radiology departments or imaging centers. So my strategy can be from the my IUM innovation or Department of Medical Physics, can be collaborate with the Radiation Safety Committee or medical device manufacturers. And future collaborators can be sustainable waste recycling companies and university research laboratories. So what we are seeking is funding to conduct clinical validation and safety testing for these innovations. So technical support for product refinement and standardized manufacturing, and assistance with patient finding and regulatory approvals, and hospital partners with multi-center clinical evaluations, and also industrial partners for large-scale production and commercializations. And my conclusions, our innovation transform medical waste into practical clinical solutions by recycling discarded radiations, lead gowns, not only reduce the environmental waste, but also improve the accuracy of diagnosing intestinal malrotation in children. This project demonstrates how sustainability and healthcare innovation can work together to create meaningful impact. Okay, thank you so much.